a lot of nomination hearings, but I'm not sure that I've seen a nominee who's as well suited for the position as you are, Ms. Cottegall, and I just applaud the career that you've built and how well it would lead to this particular post. Two questions. First, I want to pick up a little bit on what the chair asked about wage gap, but come at it from a slightly different angle. Talk about low-wage workers. I think we really need some strong enforcement in these areas, and a lot of low-wage workers, disproportionately women and people of color. How would you plan, should you be confirmed, to ensure that the EEOC is devoting sufficient resources to addressing discrimination in industries where low-wage workers predominate?
It's a tremendously important issue. As you note, that has a disproportionate impact. Discrimination in low-wage worker areas has a disproportionate impact on women of color, and the way that that ripples through their families and their communities, I think, is an area that, if resolved, would pay tremendous dividends for those families and for our communities. I think it is worth looking at the sectors where low-wage workers are most heavily involved and considering how more enforcement could be brought to bear in those areas. I certainly would be interested in looking into that issue more closely if I'm so fortunate as to be confirmed. As you know, I have represented low-wage workers in different types of litigation, some of which is under the statutes that are enforced by the EEOC, some of which comes under the wage and hour statutes. But I think the way in which they are disproportionately vulnerable, both from a pay perspective, but also to harassment, and the way those different types of discrimination can build on one another, is something of significance for our economy.
Thank you for that. I want to ask a question about disability, and in particular disability for the potentially millions of people who are dealing with long COVID. COVID-19 pandemic is being considered a mass disabling event. A recent white paper from a patient advocacy organization indicates that between 7 and 14 million Americans are expected to experience disabling long COVID. Those estimates still vary quite a bit because the research is still really digging into the severity of long COVID and the number of people that are affected. Another recent analysis found that 1.1 million Americans currently are out of work due to disabling long COVID. The EEOC has issued guidance clarifying under what circumstances COVID-19 could be considered a disability under the ADA and also the Rehabilitation Act. If confirmed, how would you advance opportunity in the workplace for workers with disabilities, but particularly focusing on those who might be experiencing long COVID?
Senator, it seems to me that the evolving landscape of long COVID is something that we need to understand both from the perspective of workers and ensure that we're providing clear guidance to employers as that landscape evolves. I think the other thing that seems clear is that the mass disabling event that has been COVID has had a tremendous impact, both from a physical perspective, but also from a mental health perspective, and understanding both physical disabilities and mental health disabilities as they arise from COVID, I think is going to be really important to getting folks back to work. I would want, if I'm so fortunate as to be confirmed, to see where the EEOC is with respect to these issues, what work is being done, both on the enforcement side to ensure that workplaces are not discriminating against workers with disabilities, as well as providing guidance to employers about how to use the interactive process to get folks back to work.
Thank you. And just to conclude, one of the things that has happened during COVID is not only have people suffered by COVID, and they still are, but also we've learned some things about a work environment that have expanded the ability, for example, to offer accommodations. I didn't have any staffers teleworking until March of 2020, and we ended up learning, wow, we can do a lot of great work via telework. Many people weren't accessing healthcare or education content via teleconnection prior to March 2020, but now have learned that they can. So the problem is serious, but there's also been some learning in the last 2 years that may broaden our ability to offer accommodations to workers with disabilities, not just from long COVID, but other workers as well.
I could not agree more. I think our understanding of what constitutes a reasonable accommodation for certain types of workplaces has expanded, as you say. I have litigated from my home office for the last 2.5 years, arguing class cert hearings from my desk on my third floor in a way that we never would have dreamed of 2.5 years ago.
Thank you, Chair Murray.
Thank you. Senator Casey.
Thank you, Chair Murray. I want to start by thanking Ms. Kodegal for her willingness to put herself forward for this nomination.